Hi, everybody. So, some of you may know me, and some of you need some introduction. My name is Uma. I am a mental health counselor, and I work in Chennai. I do private online sessions. And sometimes on this channel, I bring in guests also to talk about mental health awareness and how you can improve your own well being. So, today I have a very good friend with me. She's Mrs. Shilpa Sable. And to tell you a little bit about her, she's a certified counselor with over 7 years of experience, and she offers online as well as in-person sessions at two clinics in OMR, and she is also consulting at Cloudnine Hospital in OMR. She has recently begun facilitating small online peer support groups for individuals interested in improving their well-being. These weekly groups provide a supportive space to share your struggles and wins, exchange ideas, and explore ways to grow and thrive. So she's very passionate about mental health, just like me and just like you. So today we are going to talk a little bit about how therapy works, what is her experience, and as well as some new insights about what else can help apart from therapy. So we've come together to with 5 questions. So the first question for you, Shilpa, can we begin?
Yeah, sure.
Yeah.
Yeah.
Okay.
Thanks so much for having me.
Of course, absolutely. The pleasure is
Yeah.
mine. You've been a counselor for over 7 years. You consult at two clinics and also at a hospital. So, with all this experience, and you would have seen so many people throughout your professional experience, what would you say are common reasons for clients to approach counselors or therapists?
Yeah. Usually, people come to counseling when they are going through some sort of stress, some kind of challenge in their lives, some difficulty that they are not able to cope with, and they are not able to find support within the people, among the people that are around them.
Mhm.
And then they feel they need to seek the support of someone outside, a professional, quote unquote, who will give them some insight or some kind of a advice or suggestion, which, or maybe see their blind spots which probably they can't see. Uh, and they think, okay, maybe the counselor is experienced, has some kind of overview on these things, and can give them some relief from the stress that they're going through. So yeah, that's usually, and it's not like they that would occur to them the first thing that they need to go see a counselor or a therapist. They would have been going through that stress for some time, and then when they think, okay, let me explore this avenue as well for coping with this, then they would probably Google and seek support. And then they may again feel, okay, I mean, they may not turn up for the session as well, which is also understandable, because it takes a lot of courage to find a resource, come for the session, sit there, open up. So it takes a lot for somebody to take that step. So we cannot take that lightly. So we have to, and even if somebody is backing out or canceling, also we have to understand why it gives an insight into the distress that they're going through.
That's beautifully
Yeah.
said. And I think that's a very compassionate response. So we understand here the first thing is they don't reach out to a counselor just because they have some stress. They first try to sort it out within themselves. They see that their community is not supportive, and then they hope that maybe the counselor can shed light on some blind spots that they may have. So that's what you're saying. I'm just summarizing. So maybe they don't know something and they can learn how to tackle with the struggle or their stress. Maybe they can cope with it better. So they're looking for some sort of a relief. What you brought to the table is very interesting about cancellations, because it's not the client's fault. And this is beautifully said because it shows the level of distress that they have, that asking for help can be like, it is a last resort for them, and it can be incredibly challenging for them to actually take that step. So we need to understand and not take it personally. So this brings me to the next question. Why do you think people hesitate to approach a counselor? Why does that usually happen?
Yeah, in these times, I've noticed the most important factor is cost, the fee,
Yeah.
right? Because they are already going through a lot of distress, already stressed for time, maybe money and energy and everything. So seeking help is again another stress on the already stressed resources, right? So, and from the counselor's point of view, from the therapist's point of view, it's very much justified. The cost is very much justified because the client is getting undivided, focused attention for more than 60 minutes. Sometimes my sessions go on for 90 minutes, more than that, So it's a considerable drain on the counselor's time as well, the counselor's resources. And if we are, and in my experience, since I'm consulting at these places, so that also comes at a cost. That I'm being provided the venue, the infrastructure and all that. So overall, it becomes very expensive when you add up all these things for the client. So and that's why they can maybe come for one session and then they cannot keep it going because it is so expensive to and there are no guarantees that it's an investment and they will actually benefit out of it or gain something from it.
Exactly.
So that is a main reason people would hesitate to seek help, right? So just want to mention that this is why I came up with the free support group idea, because we need a space where we can work on ourselves without having to shell out a lot, and in today's day and age, there are many resources through which they can do, and then the support group also can be one of the ways that they can work on. And of course, the other reasons, as I said, it takes tremendous courage to connect with somebody, contact somebody, talk, turn up for the appointment, and sit in that chair and then open up about your innermost, most personal, distressing feelings and emotions, and whatever you're going through. And I want to say that is also another that can also be very dysregulating for a person. That also can then stress them further to come in front of a complete stranger, and to a completely new place, a clinic or a hospital or wherever, and then start talking about their difficulties. That is very dysregulating, and that's not necessary. I can speak more about that, if you're interested. And that is also another reason. And of course, it could also be access. They are somewhere far away and they are not able to come to the clinic, or they don't have a private space to do online sessions, neither at home nor at work or anywhere to actually engage in that kind of work. Then language could be another barrier, where we are all trained and we understand, like we speak in English and do a lot of, we read a lot and we converse a lot, but that may not be the language of the emotion, and to explain the difficulties that they're going through in their domestic situation, in their native tongue, and then maybe the counselor or the therapist is not well versed with that language, or the therapist is not able to offer the service at that. So there's a lot of work that needs to happen to even understand these difficulties. And so these are the many factors which I've seen which get in the way of people's
Yeah, definitely. So I would like to summarize for the audience. So the first thing that you mentioned is the cost, which is definitely not something that they want to spend, because usually if somebody says a pizza is like 500, 700, 1,000 rupees, they're going to pay that money, but they're going to see the product, the result. But therapy is not like that. So therefore, we can understand why somebody doesn't want to pay in the beginning. And the amount also, as you rightly said, it's not just the counselor sitting and listening. As you said, there's a lot of other things that goes in as well, which is undivided attention for 60 to 90 minutes. Depends on the session timings, which counselor would provide. And also the training that goes behind all that. So we are trained to sit and give that empathy, regulate with the client, and also using the right kind of language that the client will be able to understand or will be able to digest. So if we bring up big words like trauma or like anything like ACEs score or whatever they say in psychology, they will not be able to grasp. So also language can be an issue, the way we talk. So we understand why it can be difficult for somebody to come up. So it's not just opening a door and getting into a room. It's about the travel, regulating yourself. They don't know if this is the right choice, but they have no other go. So they're taking it as a last resort. And you also ended with something interesting. You talked about free support group, and that is interesting, but I want to get to that at the end. Now, the third question is, there is an assumption that the client has to say everything the moment they sit in the chair with the counselor. So they feel that I
Yes.
have to say the whole story for the counselor to understand me, or like that's how things have to go. Could you
Yeah.
talk more about this and other common assumptions or misconceptions about therapy and or counseling? What do you think?
Yes. So, uh, basically, how I see counseling is that, you come into contact with another person who's probably more regulated than you are, and who can hold space for you, whose cup is full, the counselor's cup is full, and the counselor is able to give some regulation, co-regulate with the client. So, the co-regulation can be just sitting in each other's presence and just calming air around. So it's not necessary to begin talking or express just by with words or sentences. But most clients believe that they need to speak. The moment they sit, they need to speak. First of all, it's not necessary to enter and sit. This is what I tell my clients as well, because some of my clients are surprised to see me. I don't sit behind the table. I'm sitting in the along with face to face with the other thing. That itself is surprising for them. And then I say, okay, if you feel like sitting, just sense the room, just adapt to the room slowly, and then you can sit when you feel like sitting. So it's a new place, new room, new person. Everything is so strange. You need some time to acclimatize to the whole environment. So take some time and relax, and then you can talk if you feel like talking, whatever comes up. All this is part of therapy and counseling, not just the talking part. But most people think the moment they sit, they need to get into the content of whatever they are going through. So, and the other thing I say is, there is no need to reveal your most painful private matter to me. And you can, when you feel, if you feel like you want to lean in and you feel safe and you want to talk about it, you can talk about it, but you can still work on whatever you are going through without going into the most painful, the core of it. You don't need to jump right into the most difficult aspect of your experience, right? And that also takes them aback, because they think when they come to a counselor, they need to open up about the most private, closely held thing that they have not told anybody. They need to tell this complete stranger. And going back to the previous question, that also could stop them from seeking help, because they think that the moment they say they have to reveal, and they're compelled to reveal, and they feel like, oh my god, if I can't reveal, if I can't talk, what's the point of going to a counselor, right? And that could also be holding them back from seeking another resource, right? So that is a main assumption. And again, we can co-regulate without talking about the most difficult, because when you're going through the distress, just meeting somebody and getting some kind of regulation, and just feeling like you're seen, heard, regulated, cared for, some kind of empathy you get, that itself is very healing and can help you in many ways without you going into the most traumatic memory of what your life has been about, right? That is one thing. And the other thing is, some of the assumptions that, the counselor knows better, she will be able to guide me or suggest or advise, right? So again, or putting the counselor on a pedestal, or thinking they're a doctor, that they will give some prescription, or will give some diagnosis. Again, giving a higher status to the counselor, which is again not correct, right? Because we are the experts on our own lives, and you're just thinking aloud and being with another person in that process, who's at the same level as you, but you're just getting a person who's regulated and maybe probably has some experience and views on things which you probably have not considered. Other than that, the counselor or therapist is not in an elevated state or any kind of expert on things, right? And culturally also, right? Culturally also, we have many different practices. Many different ways of being in families, workplace. The counselor may not understand all the cultural context. For example, a young person who's in the 20s, who's just started, and if a person who's in their mid 30s has a full joint family with mother-in-law, sister-in-law, all kinds of people, the young person may not be able to relate to what this person is expressing. I'm talking about my clients at the hospital, right? Who are going through pregnancy, who are trying to conceive or whatever. So maybe not all counselors can understand their experience and what they are going through. So the clients cannot assume that the counselor will know everything and will understand everything, and be able to see it all points of view that I'm expressing.
Yes, and this is so beautiful that you laid it out there, because it is true that the client is the expert of their own life, and we understand that. We are not here to say that I know what you need to do. So the counselor
Yeah.
is not going to take that role, at least a good counselor. So this at
Yeah.
least I think helps the audience feel that it is okay to meet someone, even if you don't say everything that is inside you. You can just sit with them, their presence, just being with someone where you feel that you're being cared for, that they are looking out for the good things in your future, like something to look forward to. They are
Yes.
going to discuss with you and not tell you what to do, not advise. So I think
Yeah.
the things that you said are like on point. And also, if I can add, like, it is also okay if you want to say everything that's in your heart and to this counselor.
Yes.
Yeah, that is also totally fine.
Yeah.
Now, did you want to add anything?
No, I was just saying the empathic witness part, right? Maybe they say something that they've never said to anybody,
Yeah.
and the counselor is able to say, "Yes, I get what you're going through, and that could have been a really difficult experience," and validate that.
Yeah.
That itself could lift a huge weight of the person, and that there is somebody who's understanding. That empathic witness uh, role that which we can play, that is important in this context.
Yeah, beautiful. I like the example that you gave, that a young person will not understand what their in-laws or the relatives are saying, who are probably elder to them. And in the same way, they don't feel understood as well, because there are very few families who are curious about the young person's inner world. So when they get that validation, it's not just validation, it's a relief for them that I can finally get it out, and there's someone who's willing to understand what is happening inside me. So that's nice.
Yes.
How can people work on themselves without seeking therapy in a formal setting? So I understand that you do not go, your approach towards therapy is very unique. For you, therapy starts the moment the person comes inside the door. You give them the space to be themselves, to unfold in their own pace. So,
Yes.
knowing that, I want to ask you, what is any other way that they can try healing themselves or helping themselves?
Yes. I mean, since you started with this thing of giving the space and unfolding. So, the moment I make, like, the person makes contact with me, right? Like, maybe I'm standing at the door itself, I'm opening the door and I'm welcoming them, receiving them, which probably, I mean, when they see me as a doctor, I'm not a doctor, but they see that, okay, the doctor's sitting behind the desk and waiting for you to come and sit. So, but from what I've experienced with some of the therapy that I've taken, this is what I've also observed and that I've incorporated in my own practice as well, where I'm receiving, I'm, being there, I'm standing, talking, like it's like building a relationship right from the get-go, right? So, one of the things I would say that people can work on themselves is that if they have good relationships in their lives, warm, supportive relationships, that itself is a huge resource. And when I say this, like, when, it doesn't mean that it's I mean, you have all kinds of relationship. It doesn't even the definition of what a relationship is, right, where you're like totally connected and revealing your thoughts and feelings and connecting at a deeper level. It need not be that, even just connecting with the world around you, people around you, in little ways, right? And feeling that, okay, there are others around me. When you're interacting with probably the vegetable vendor or the security guard, they are all playing their role, but you still have some kind of relationship with them, right? That they are there, keep doing whatever they do to contribute to your life. So even feeling that connection, and this is what I've observed, where people are feeling, so I've heard many people say, my circle has shrunk, I feel isolated, I've lost touch with many of my friends from college, I don't want to bother them, I don't talk to them, so as the life's challenges and stresses come, we lose connection with people and just make it small, life smaller and smaller. So again, it does not have to be that you're getting into a deep relationship with anybody, but just keeping little interactions with people on a daily basis.
Yes.
Making eye contact or just saying hello, how are you, or whatever, right? These things you can do on a daily basis. That's what I mean. That so the relationships that we work on and invest in on a daily basis without much investment, just little interactions. These things help. And as I said, well-being is not just talking and dealing with your thoughts, right? Which I've experienced in my own life. I've also gone for therapy, and I've also noticed that is just one part of my well-being. There are many areas which we neglect. And I've seen this in my clients as well. When I talk about how are you sleeping, how's your diet, they find it strange. What does that have to do with what I'm going through, So what we eat, our diet, when we eat, how we move, how much we sleep, all these things are connected to well-being. And but the misconception is exercise is weight loss, diet is weight loss, or and even I was under all these. I mean, I also was ignorant about this, but when I started practicing, I realized, oh my God, it's such a so everything is so connected. And what I do on a daily basis, right? Like I'm walking or I'm stretching or what I'm eating, how I'm sleeping, all these things are having an impact on my well-being and my emotional well-being and the ability for me to tolerate whatever stress is coming my way, how I'm being present in my relationships. So right from the get-go, from the moment, like, I mean, all the time in your day, whatever you're doing is kind of having an impact on how you feel and your emotional well-being. So this is what I mean by how people can work on themselves uh, uh, without really going for talk therapy and talking to quote unquote, qualified professional and spending the money. That's what I mean.
Yeah, there are a lot of different ways to take care of our well-being. It is sometimes it is necessary for you to talk to someone so you can get different perspectives. Sometimes we'll be going round and round in our own mind. But again, this is
Yeah.
a new perspective where look at what you're doing from morning to night and where you're spending your energy. And having these little
Yes.
interactions actually opens up your mind to say that you're not actually stuck inside a room, that you can talk to people. And socializing doesn't mean that you are giving your contact to some hi-fi individual and networking. That
Yes.
even talking to a shopkeeper is just socializing. That doesn't have to be
Yes.
a start and end to a conversation. It can just be like a normal day-to-day conversation with no
Yes.
agenda to it. So that can
Yes.
also be healing. So
Yes.
that's wonderful. I think there's a lot to share on this aspect. So I think you do have a lot of resources which you share during your free peer support group that you are facilitating. Could you tell us more about the free peer support group and what you guys do there?
So the idea is to get together and talk like this, where uh, it we are not, spending money, or we are not opening up our most vulnerable, innermost secrets, right? So, and it's not possible to get into that in this kind of a, and also to dispel the myth that you can heal or you can feel good only when everything is resolved, or only when you get a solution to your distress or the problem, right? All these other things that I spoke about, you can start doing on a daily basis, right? Like walking, being in the sun, or just singing, using your voice, moving your body, and all these things you can do on a daily basis. And in the support group, we talk about what gets in the way, what is our experience with taking care of ourselves, how, why I'm not able to do this, or I did this and I noticed this. It's just a place where you can connect with others who are similarly going through the same thing, and you kind of also are accountable in a way, what happened with my week. Yeah, this is what I'm doing. And so the idea is to dispel the myth that you need to go for formal therapy and only then you can start feeling better, right? You can do the daily things that you are doing and you can start feeling better. And as you start feeling better, you know what to do with the situations that are stressing you, or the distress that is there.
Yeah.
Right? So to give that, because we are not, as I said, we are not connecting exercise to mental health, or learning music with mental health, or walking with mental health, or even making eye contact or just chatting with somebody is contributing to your mental health. So the daily practices that we can do, what gets in the way, what others are doing, and you don't have to seek expensive professional help. You can still connect with others who are in the similar situation. Just exchange a few notes and be on your way for the next week and come back.
Yeah.
Just as a safe space. So that's the idea behind the support group.
That's wonderful. So, from what I can gather from what you've been saying is that therapy is not the only way to heal ourselves, and saying our vulnerable, most distressing story and finding a solution to that is not the only way or the way to heal. So, it's also about just regulating
Yes.
ourselves day to day, and you will find your own
Yes.
solution within. And doing that with a community is even more powerful because there's another person watching you and another person caring about you, and you get the sense that you're all growing together. So that is a very powerful thing.
Yes.
And you as a counselor having so many years of experience facilitating that can be very grounding for the people who join. So if anyone is willing to join, please do check the description and we'll be providing the details. And I think this was a very interesting eye-opening session where we talked about why people go to therapy, how therapy can help, and what are other ways we can help ourselves. So thank you so much, Shilpa, for being a part of this. I can't thank you enough. And I hope you enjoyed being in this space with me together.
Yes, it was a great conversation. Thank you, Ma, for having me here.
All right, wonderful. Bye.